Bismillahirrahmanirrahim. So here is the quiz related to mediastinum and great vessels. Which is the level of sternal angle bifurcation of the trachea? At the bifurcation of the trachea, its level of sternal angle. Next, the brachiocephalic artery branches into right subclavian and the right common carotid artery, and it's true. Next, which is not in the posterior mediastinum? Thymus, because thymus is in the interior mediastinum. Then next, the esophageal hiatus is at which vertebral level? The esophagus hiatus is at T10, and at T8 there is inferior vena cava level, and at T12 there is the hiatus for aorta. Next, in the upper chest, the lateral branches of sympathetic chain supply the body wall and the limbs through the spinal nerves, and the medial branches supply the lungs and heart. Is true, because medial branches supplies the lungs and heart. Next, the narrowing of the thoracic outlet could compress the all of the above, because these structure brachial plexus, subclavian artery and subclavian vein are present in the thoracic outlet that can be compressed. Next, the place in the order from the anterior to posterior. Most anteriorly is located subclavian vein, then the muscle, that is anterior scalene muscle, and then the subclavian artery. So this is the anterior to posterior sequence. First of all vein, then muscle, and then artery is posteriorly located.